The Open Health Information Mediator, or OpenHIM, is a piece of software, a middleware type of software that serves as the interoperability layer in a health information exchange. So we developed this as part of a master's thesis of one of the employees at Gembi, developed it as part of his master's thesis at the University of KwaZulu-Natal, probably about 7 or 8 years ago now. And we've implemented it in a number of different countries. So the OpenHIM, as I mentioned, serves as the interoperability layer in a health information exchange, and it has a number of different functions. In addition to that, it receives and stores data and then orchestrates it through the health information exchange, and also has a number of additions to it called mediators, which are microservices, which can be added to the OpenHIM and extend the functionality of the software. So the OpenHIM was originally developed for Rwanda as part of the Rwanda Health Information Exchange. That was the original research project which gave rise to the OpenHIM. And it worked, that was applied in the Ramagana district in Rwanda for several years, supporting maternal, newborn and child health between community health workers, facilities and a central level. So it brokered the information flow between the community health workers, systems, the facility-based registers, and then the central level. And then as a result of that project, we formed the Open Health Information Exchange project, which is an open source community and architecture for health information exchange. And the OpenHIM became the reference technology for the interoperability layer of the OpenHIE. So, and it still to this day is one of the core reference technologies of the OpenHIE architecture. It's also been used in a number of other settings. So it's been used in South Africa for the Mom Connect project. This is a large mobile maternal, newborn and child health project supporting antenatal care in South Africa. And the OpenHIM is, again, the interoperability piece of the stack that receives and sends messages to pregnant women and then collects the data with the web DHIS.
One of the big sort of flagship-ish implementations is in the Mom Connect space. So that's, I believe, an SMS line that is used by expecting mothers, and that transfers data back and forth. And OpenHIM is a core component there in ferrying the data back and forth between the central data store and the SMS services. And additionally, it's used to then send that data through to the PHDC again, so the PHDC has a record of that data. So in this instance, the OpenHIM is responsible for sending it out to an FTP service that then FTPs it across to the PHDC. So obviously that's another situation where the OpenHIM is used as a conduit between two different systems, and then it's also spitting data out to a third system, in this case, the PHDC.
It's also been used in the Western Cape province, in the city of Cape Town, where it mediates the flow of data from premise, which is the system, the primary healthcare system used by the city of Cape Town, to the DHIS2 application as well. It's also been used as part of the AHIE project in the provincial health data center as well, where it also mediates the flow of information between some of the community health worker systems and the PHDC main database system, as well as with the SPV system. So the OpenHIM, as I mentioned, it largely serves as an interoperability layer between different components that have been developed and matured as part of the AHIE. And in particular the catch and match system, as well as the interface with the SPV and the provincial health data center itself.
The OpenLIM, which we haven't discussed up until this point, is our other application. It's a little lightweight Windows application, and its purpose is to grant online aware capabilities to a system that otherwise doesn't have any online awareness. So the system in this case is tier.net. So it is designed to be good at the one thing it does, which is the TB and HIV registry. It doesn't handle network connections or online awareness or anything like that. But what it does do, as many of these kind of offline systems do, is it handles file import and export. So what the OpenHIM does is it sits at facility alongside tier.net and monitors the folders that the tier.net imports and exports from, and can perform actions on files that land there, and obviously fetch files to put them down there. One of the interesting parts about the OpenHIM is its name. So OpenHIM is meant to be a play on the OpenHIM. So OpenHIM, to remind you, is the Open Health Information Mediator, and the OpenHIM stands for Open Local Health Information Mediator. Initially, it was seen as a local corollary to the HIM in that it was a mediator that sat on the computer at the facility and perform many of the same functions as the OpenHIM. That's not entirely true. It is involved in the flow of information, but I think calling it a mediator is definitely a bit of a generous stretch, because what it does is it monitors a file folder and can make requests. So those are, obviously, so making requests is something that a mediator can do, but I feel like there's a lot more that it needs to be able to do to truly be called a mediator. So really what it does is it just grants online capabilities to a system, tier.net, that doesn't have it.